Welcome to the AME Food Testing Show. Today's topic, Diagnosing Foodborne Illness Outbreaks with Roy Costa. Roy is the founder and owner of the consulting firm Environ Health Associates, Inc. Mr. Costa is a registered professional sanitarian with more than 30 years of environmental health practice in the academic, government, and private sectors. Mr. Costa is a food safety consultant, educator, auditor, and expert with international experience. His dynamic practice specializes in the prevention and control of contaminants that may be transmitted through food, environmental surfaces, and water. Now, welcome with me, Roy Costa. Roy?
Well, thanks, Andy. I appreciate an opportunity here to speak with you and your listeners about this important subject.
Well, you have been a busy professional in food. In fact, the penning of this recent article in Food Safety News is particularly compelling. Let's start off with a basic question. What is a foodborne illness?
Andy, that is an illness that someone might experience after eating a contaminated food. And by a contaminated food, we mean one that contains some sort of deleterious substance, whether it be a foreign object or a chemical or a microbial problem, a pathogen, for example. So the illness that people talk about when they talk about a foodborne illness is actually in two categories. One is food poisoning, which people might be familiar with that term, and then the other is a food infection, and they have different etiologies. For example, with a infection, you're going to have a fever. With a intoxication, you're probably not. So there are some telltale signs with these diseases that we can pinpoint, and we can pretty much be sure that if you've got diarrhea and vomiting, it's probably something you ate.
Very good. What are contamination sources by microbes?
Essentially what you've got are microbes that are passing through these production systems. They are transient microorganisms. And they could come in with the material themselves, they can come in with people, or they could be resident bacteria, which would be something you would definitely want to avoid them harboring in your equipment or in your facility. So the niches that these microbes inhabit are essentially hard surfaces where there are points of attachment where they can colonize and grow. So faulty connections, bad solder joints, just equipment that doesn't fit well and is leaving gaps and spaces. And then you have the environmental niches. And these microbes are capable of colonizing a wide range of environments, everything from some type of drain to a floor to a wall, anywhere where there's moisture and a place for them to harbor and hide, and a food source, you can expect a microbe to be around. Now, not all of these are, of course, dangerous. They will be dangerous, though, when they reach a certain number, or they're the type of microbe that is associated with infection, typically. And then we have the niche that the microbes inhabit with humans. And so we carry around our own set of microflora, most of which is benign. But occasionally we become ill and we can transmit that to other people. And in some rare instances, a person may be a carrier and have no symptoms, but yet be able to transmit the illness. So that's another niche that the microbes inhabit, would be the human body. And then the third significant source of these would be food itself. So the production system can bring in contaminated food products, meat, poultry, eggs, fish, all become contaminated potentially during the processing of these animals. So we have a specific level of risk. We could talk about certainly pretty high with poultry, a little lower with beef, and much lower with eggs, but still they're there. So long story short, actually 4 areas we're concerned about in terms of the microbes getting into a facility, and that would be the food, the people, the equipment, and the environment.
Roy, that is an excellent summation of our challenge. So the negative part of those organisms is the actual harm they cause people. That is generally termed as an outbreak. Can you define the parameters of an outbreak?
Sure. The outbreak is a definition that will rely upon the Centers for Disease Control and Prevention for this. And this the definition's actually gone through some changes over the years, but currently it's when 2 people minimum ingest a common food and then become ill. I'd like to expand that a little bit and make you understand that it's not just a common food, it's a common exposure. So if 2 people eat at a restaurant, one of them has one type of meal, the other has a different type of meal, but they both become ill within a reasonable amount of time, then you have to say, well, maybe it's something that's common to both foods. So, but the definition has always been after eating a common meal. We used to consider one case of botulism or one case of sigma teratoxin to be sufficient for a outbreak, but we've changed that now to 2 or more.
Very good, Roy. Your many years of experience as a sanitation expert for both government and private organizations in the state of Florida, which is known as a destination state, brings to fore your expertise in the next question. How is an outbreak diagnosed or declared?
Well, that's it is a function of government, as you say, and in league with the medical profession, of course. So an ill person could go to a clinic or a lab and get a test done on stool or blood, and they could culture a pathogen from that person in a clinical setting. All of those that fall into the category of pathogens, well, not all of them, but many of them are listed on a list that is required to be reported. That's a reportable disease registry list. And the medical folks, the clinics, the labs, are aware that they have to report cases, isolates of Salmonella, Campylobacter, Vibrio, a host of others, Shigella has to be reported, hepatitis. So one of the ways that it comes to light is when a health department starts fielding an unusual number of these from the community. And it's usually a function of the public health nurses who are working on the epidemiological data and then forwarding it over when they see something unusual, trend, cluster, etc., to the public health folks in the environmental health sections, who then have to go and try to see if something's going on in the community. Another way this comes to the public health attention is when a mass of people are exposed all at once, and they end up in a clinic, and all of a sudden you've got 8 or 9 or 10 or 12 people. You may not have clinical isolates from them all. You might not have the confirming diagnosis, but you have 10 people, for example, all sharing some common food element, some event they were at, etc. And when that occurs, most health departments have a good relationship with the ERs, and that gets to them. There's also poison control centers. People who have been exposed to some of these foodborne agents feel like they've been poisoned, and in fact they have, and may in fact call the poison control folks, and that's another source of information there. And that's typically how they come to light. Somehow there's a trigger within the medical profession that triggers over to the health department. And of course, many of these get lost in the shuffle and never get reported. We only investigate perhaps 10% of the actual occurrences that might occur in a community.
Well, Roy, that summation focuses on the public sector's investigation of these outbreaks. What exactly are the tools that are used by these investigators, typically known as epidemiological investigations?
This is a science in itself, and in reality there is a number of steps that one goes through in an outbreak investigation. First of all, there's something called establishing the case. We have to be very clear who's excluded and who's included in that definition. So we have a case study that might have to occur where we have to distinguish the time, place, person relationships within that exposed population in order to determine who the cases are and what they look like. So once we have that cohort of people understood, and we know they ate at a certain place at a certain time, they all had a certain type of meal, for example, as opposed to some other exposure, like possibly some public bathing site or a child care center or something. We have to take into account any confounding kind of information. And then once we have the case definition, then we can start to do what's called case finding. So the case finding then is go search and make sure we identify as many of the cases as we can. So we have this exposed population, 500 people that ate at a restaurant. And then we have this known number that have reported to us, 6 of them. And then we have to go and find the other 500 people and find out what they ate, what they didn't eat, and do some statistical work. And this is known as a case control study. And what we try to do is determine the relative risk of exposure to a particular meal in a particular time, a typical ingredient sometimes. And then we statistically can tell by analyzing those who were ill and those who were not ill, we can analyze this and determine with a pretty good likelihood what the actual vehicle probably is. So sometimes there's multiple vehicles involved, and it helps if we have laboratory work done. So the laboratory work is in two or three different areas, actually. It's patient cultures, then we have food samples, and environmental samples. So along with all of that information, what the people ate, their symptoms, how long it took them to become ill from the time they ate, which is called incubation period. And that average incubation period in a very large outbreak can be a known number of days or hours. And then we have another means of confirming the outbreak. So what we try to do is confirm the outbreak, either with lab specimens or very, very strong epidemiology that points to a particular food product and a particular group of people and is statistically significant.
So from a process orientation, your team, the governmental team, determines that there has been an intoxication. It's very similar to DUI, but this is food-caused intoxication. And then what are the notifications that are given to the public, or recalls of products, or stopping of the sale of the products, or even closing of the affected businesses?
This has become quite a controversial area. I have to say that before I go on into detail, because the government, of course, is going to be able to only do what it can do within the political climate that they're in. So public health officials have to be very, very careful nowadays in the United States about when they notify people and how much information that they reveal, because a mistake or a let's just call it, the way things go sometimes, you might have a very good idea of what's happening, but later on it turns out to be something a little different, and you've already gone on record as saying a particular restaurant at a particular time with a particular ingredient, and you're stuck with that. So the health departments are very cautious, and they won't go public until they have typically a confirmed outbreak. So they have to have enough data in order to make that call. And so it could be days or weeks, unfortunately, before they have enough data. They may have a very good idea that a restaurant or a place of, some eating place is involved, but they just don't statistically have enough data in order to come right out and say that. And then the next issue is the recalling of product, and that's a very similar problem, because a company could go under from this. Having to recall maybe a month or a few weeks worth of product probably wouldn't kill you, but sometimes these recalls, because of some other factors, might affect millions and millions of units and just be a year's worth of production and completely cause the demise of the company. So recalling of the products is, again, done very judiciously, but when it's very clear that there's a contaminated product in the supply chain, when the officials have that evidence, then at that point it's a lot easier for them to put pressure on the company. Now, we have to recall that the Food Safety Modernization Act gives FDA especially new powers. They have not exercised them to any extent, because typically industry will do this on their own. In terms of stopping the sale of product, that's a little easier to do because you're only going to deal with the affected product that you actually see involved at the time, the lot code, the lot number, whatever batch production was going on. So that's a more limited intervention, and we can usually do that without too much problem when we, even if we just have a strong suspicion of the nature of it. And when we talk about closing an affected business, that almost never happens. And I want to make this point because I think it's important, and people don't realize this. It's not illegal to cause a foodborne illness outbreak. It's illegal not to follow the food code. So we don't actually penalize a company for just simply having an outbreak. That penalty comes when a facility has an outbreak, comes under a great amount of scrutiny, and then it's revealed that the company has serious violations of sanitation, for example. And at that point in time, the pressure might be there in order for the government to close the business, but it very, very rare that happens because of government action. It's usually a result of the business just going out of business because no one will buy their product.
Roy, in many of your writings, and again, you're a prolific author, instructor, and lecturer on these topics, are there any tools that are the most helpful in identifying the causes of a foodborne illness or outbreak?
Yeah, the causation is a process of distilling a lot of information. So we have to use the tools that we have, and that really points us in the direction of the statistical models here that we use in epidemiology, and that helps to define within a range of probability what likely associations there are between the food, between the people, between some activity that's going on. So the statistics really help drive. And then the next tool is the laboratory and microbial findings. We have to have these. We have to have clear diagnosis, confirmation through stool or blood work that clearly shows what organism we're dealing with. So once we have the food product, either with a lab test or very conclusive statistical analysis, and then we have the confirming lab results from the victims. And the best scenario, we'd have the same match. We'd have a clinical sample that has salmonella and a particular serotype, and then we would have a piece of chicken or something that has that same salmonella in it. And when you have that, you've got very conclusive evidence. We don't always have that, probably in only 10 or 15% of the time. And that's growing. When I started doing this work 30 years ago, it was about 1%. It could be confirmed. So we're getting a lot better than that. We're probably up to 20 or 25%. And I would say those areas are the most helpful.
Roy, there is a particular technology of a modeling that particularly helps food producers and consumers. That was developed for the Apollo Moon Project originally. It's known as Hazard Analysis Critical Control Points System. Can you identify the essentials of that and how a modern sanitarian uses that system to optimize their tasks?
Sure. Hazard Analysis Critical Control Point is a preventive program. And what we do with this is we try to determine the most likely points of contamination in a food production system. And once we determine where it's most likely to occur and where the effect could be most severe, then we just define particular spots in the production system as critical. And we call those critical control points. So we do the hazard analysis by identifying those areas that carry the highest probability of a risk, and then we specify the critical controls at that point that are necessary in order to reduce, minimize, or prevent the hazard from occurring in the finished product. That helps us a lot because it helps us to focus on what's absolutely essential in a production system. And what we do, because we can't forget about general sanitation and all those other things that underlie the food production system, we have to have very, very strong what we call standard operating procedures that are very detailed for all the so-called non-critical steps. There are these standard operating procedures that help to make sure that we don't get cross-contamination in the system. We don't have the human element showing up, and we don't have other process failures that we might not have anticipated. So we have to have those basic sanitation programs in place, and then we have to verify that the systems are working on a routine basis. So there's a good deal of record keeping there that has to be done with a lot of oversight over the monitoring of these so-called critical control points. Typically, it's going to be temperature controls and time controls and sanitizer concentrations. And when we do that, we get a pretty complete system. But the only thing we need in addition to that would be components that we call now a food safety management system, where we are really defining the inputs and outputs of these processes very, very carefully, and pinpointing our controls even more focused. So HACCP is Hazard Analysis Critical Control Point, and another very useful model that we can use for prevention.
Well, Roy, in your vast experience and now in your private consultancy, can you outline some recent cases where your skills have been particularly helpful to reduce the issue of foodborne illnesses?
Well, what we have is is always a challenge, Andy, when you're faced with the real world problems that the food production people face. And we try our best to put ourselves in a preventative posture where we are working very, very diligently to prevent something from happening. But occasionally there are breakthrough events and things occur. And when that occurs, we have to have a very, very quick response to this. We have to be able to work with the people that are affected, find all the affected product. We've got to have very sophisticated inventory management systems that tell us exactly which products were being prepared during a period of contamination, and lot numbers and things that we can do to get that product back, have it tested, have it destroyed if it's contaminated, et cetera, et cetera. So one of the most important things that people can do to protect themselves from these types of occurrences is having a very robust traceability program. And unfortunately, in many, many outbreaks that we've seen, somehow the traceability has fallen apart. Last year we had a problem with a parasite known as cyclospora, and the CDC detected this in clusters of cases that had been reported to health departments, primarily in the Southwest, Texas, at many of the cases. And the CDC was really baffled as to what was going on. And it took them months of talking to people and reviewing what was known about it before they were able to identify that it was most likely coming from processed leafy greens. And the focus was on a couple of retail chains that were that just had clusters of cases. But there were some anomalies here, because later in the outbreak they were turning up cases that had nothing to do with these two retail establishments. Early in the outbreak, it appeared that it was two restaurant chains. And then they started to detect cases that were not related, and that were not related to bagged salad items either. So they were able to trace the materials in the bagged salad items back to a food processor in Mexico. And they determined that at least the bagged salad items had some sort of origin that they could tell. But what they determined was that there was cilantro also causing these same illnesses that did not come from the same operation. So we're left with this problem of where did it come from? You know, we have two different items contaminated with the same microorganism in the same period of time, which has led to some speculation. One of those being an environmental exposure that was occurring simultaneously in both growing areas, but we'll probably never know. But it just goes to show you that we can't always put our finger on the problem. We can't always identify where it's coming from. We can't always stop it. These cases went on for several months, and they would have continued to go on except that it burned itself out. You know, there was nothing the government could do about the Mexican produce. They went down there, they looked at the operation. They did not find a thing wrong in Mexico. Not a thing. So we do the best we can. We try to intervene as early as we can, but sometimes we just don't. And what happens is that our systems are just not sophisticated enough.
Roy, thank you so much for your contribution and your excellent article. I recommend everyone to read it and study it, whether you're a consumer of food or whether you're a producer of food. I'd like to now allow you to brief our audience of 79,000 food production, food safety, food quality, and food security managers on your practice and any upcoming events that might be of interest to them.
Okay, Andy. Well, Environ Health Associates was formed in 2003, and we have focused primarily on food. However, we have some broad background in a number of disciplines, including chemistry and engineering and other areas that give us a very diverse ability to participate in a number of important public health protection concepts. We can work with water systems, food systems of all types, infection control. So environmental health is quite a broad practice, and we certainly are interested in helping people develop these programs based on hazard analysis, critical control point. And we're also actively involved in teaching this concept. As a matter of fact, Andy, we've got a class coming up the 13th and 14th in DeLand, Florida, and hopefully at the conclusion of this, if anyone's interested, they can contact us, and we'll be happy to send them some information about the classes that we do offer.
Roy, I am posting, with your permission, your contact information, which includes your HACCPtraining.org, safefoods.tv, HACCPprinciples.com websites. I'd like to now allow you any closing remarks in this excellent discussion.
Well, I just want to thank you, Andy, for the opportunity to participate in this. I appreciate your making the time available, and you're doing this. I think, we never have enough information. There's never too much science, so it's great, and thanks very much.
Well, Roy, I thank you and wish you a great evening.
Good night.
Good night.